So if I may introduce you to Professor Evgen Benedik, who's a nutrition specialist and who will explain this very, again, important issue related to quality of life.
Hello, once again from my side. As was already mentioned, my name is Evgen Benedik and I'm coming actually from two different organizations. The first one is University Medical Center Ljubljana, Division of Pediatrics, and the second one, Biotechnical Faculty, also from the University of Ljubljana, Slovenia. First, I would like to thank the organizers to inviting me here to talk about one really interesting topic. And as you will see in the following slides, there are some improvements made on this topic in the last few years. So the title of the presentation is Common Nutritional Issues in Patients with Neuromuscular Disorders. And because I'm coming from pediatric organization, I will mainly focus on children. As mentioned, there is a lot of work has been done and published this year with these authors here with a journal Nutrition in Clinical Care entitled Nutritional Practices in Pediatric Patients with Neuromuscular Disorders. This paper is really nice written, and for all of you who are interested in nutrition, especially in nutrition care in pediatric population, I would really like to point out that this paper is really good written and you can read it through. But in my presentation, I will point out, let's say, the most important fields of nutritional practice in neuromuscular disorders patients. So actually, I will go through this paper in the next 15 minutes. So what are the common pediatrics NMDs? They are listed here. I will not go into details in some diseases, but I will just overview all of it. And here it says that NMDs vary in severity and might delay motor development, impair function, and respiratory and swallowing muscles, and lead to cardiac and orthopedic complications. And some of those complications are also connected, of course, with nutritional status. So the most common issues in pediatrics are also shown in this slide, are feeding, swallowing issues, aspiration, then of course aspiration pneumonia, reflux, vomiting, constipation, diarrhea, abdominal pain. Then if we are using steroid, we have also then steroid side effects such as stunted growth or weight gain, and some other complications. They are also possible, but also very interesting from my point of view, from nutrition's point of view, is body composition. So there is increased adipose tissue in general and reduced muscle tissue. And of course, muscle tissue is very important for obtaining optimal metabolism in our system. So clinical features of common pediatrics NMDs are written here, and I will go through all of these 5 different diseases, of course with this nutritional point of view. And if we start with spinal muscular atrophy, the most common issues here are dysphagia, bulbar weakness, prolonged meal times. These prolonged meal times, it might be really let's say annoying from one side for the parents, and we will discuss about this a little later. Then choking, weight loss, constipation, delayed gastric emptying, and poor gut motility. In Duchenne muscular dystrophy, we have dealing with overweight or obesity children, increased fat to muscle ratio, which is a consequence of, let's say, used corticosteroids. So this is like a side effect of corticosteroid use. Consequently, increased appetite, poor growth and height, and then also calcium and vitamin D deficiency is quite often in those patients. Then the next one is myotonic dystrophy type 1. Here we have also, let's say, bulbar weakness, different nutrient deficiency, hand weakness, limiting self-fed, weight loss, underweight in this situation, constipation, again, diarrhea, abdominal pain, and difficult eating behavior. Then the next one is congenital myopathies, feeding and swallowing difficulties. We are noticing here aspiration, underweight, growth failure, gastroesophageal reflux, constipation. And the last one is Charcot-Marie-Tooth disease. Here are not any special data in the literature. I also went through the literature because it wasn't stated nothing here. And it's really no convincing nutritional approaches are not described anywhere, but usually those patients are, of course, as any other patients listed above, treated like individually. And then, if necessary, we also, let's say, optimize their nutritional needs. Here are some recommended dietetic approach for children with NMDs. We will go in the next few slides in details. We will go through every single step and try to, let's say, point out the most important approaches. So the first one, diagnosis of disease as such. Of course, here you need doctors with different specialties, pediatricians, pediatric neurologists, and gastroenterologists, and genetics, etc. And when we know what is a diagnosis, then of course in this team, it should be multidisciplinary team, and it should be included also dietitian, to provide the knowledge about the optimal nutritional status and optimal feeding regime for the child. The next step, goals of nutritional care. Here we have like three main goals from my point of view as a dietitian, as I said. So we try to optimize nutrient intake to prevent growth failure in one side and obesity on the other one. Assessing and treating feeding and swallowing difficulties, of course, with also other experts on this field, and assessing and treating gastrointestinal problems such as constipation, diarrhea, and reflux, of course, in combination with a pediatric gastroenterologist. Here I would like to point out that in DMD disease, it's especially important also to monitor the vitamin D and calcium intake to optimize, of course, the bone health as well as the corticosteroid side effects of weight gain and short stature. The next step, so-called targeted assessments, here is important for dietitians to know that every 6 months it should be evaluated with a 3-day dietary history or dietary record to estimate the macronutrient and micronutrient as well as energy intake, and based on this data we can then optimize the nutrition for every single child. And the second one, the symptoms of dysphagia, choking, prolonged meal times, aspiration, reflux, constipation, and diarrhea also should be taken into account, because on those problems we can also offer to our child or to parents some practical nutritional advices how to deal with these problems. And the last step in this table here is targeted intervention. Here I would like to say few words on dietary modifications. So as I said before, on one hand we can enrich the diet, on the other hand we can, lowering the energy density in case of DMD disease, or in case if there is a rapid growth in body mass. Of course we can do this with different, let's say, different options are available. Then we can discuss about supplemental feeding, weight management as such, and then also healthy eating education for patient and family as well. We can also check, as mentioned earlier, the calcium intake, vitamin D intake, iron intake, and then we can try to figure it out which food items would be most suitable for the infant or for child to compensate those calcium or iron status. We can also discuss with parents regarding the type of food. It should be soft food, should be thickened fluids, should be thickened foods. We can also try to help the parents how to thicken their fluids with different kind of thickeners available on the market. And of course, we can also discuss with them the tube feeding protocols, which will be described a little bit later on. And then whether the constipation problems, we can enrich the fiber intake or optimize the hydration status of the patient, and so on and so on. But most important point of view from, let's say, dietitian perspective is that fasting in all cases should be avoided in all patients with NMDs, because we need to stabilize their energy requirements, and we need to, of course, prevent the muscle breakdown, which are on those patients, the muscle mass is really, really important. So here are presented different nutritional issues and, of course, also dietetic interventions. As you can see on this slide, some interventions, of course, they need to be taken also by doctors specialized in, let's say, gastroenterology or endocrinology or neurology, but dietitian can help to provide some optimal status for the patient. So in case of swallowing difficulties or aspiration, we can discuss with the parents maybe to change their food consistency. Then we can adjust feeding positions and sittings. We can go through self-feeding and safe swallowing procedures. Then, of course, here can be included speech pathologist for swallowing assessment, and here we also can talk and start talking with the parents regarding the tube feeding. In case of poor calorical or nutrient intake, we have several different possibilities in the dietitian world. How can we improve the energy density of the food? We can use different kind of oils like MCT oil, or we can use, let's say, protein to encourage or to increase the protein intake. And we can provide different, let's say, advices to parents how to do it with simple steps at their home or their kitchen to optimize the nutritional intake of their children. In case of gastrointestinal problems, I mean here mostly constipation, we need to discuss about, as I said before, proper fiber intake, proper hydration status, maybe also use of some probiotics. And we also need to work in team with the gastroenterologist to exclude some other, let's say, physiological aspects. And if there is only a constipation, we can, of course, then have, as I said, different options to help the patient about this problem. About the corticosteroid side effects, here we need to be quite careful, and we need to speak with the parents and child before the corticosteroids are actually implemented, because corticosteroids increase the appetite. That's one, let's say, problem, and we need to discuss about healthy food in this case when the children or the adult is in corticosteroids. So a little bit more about oral nutritional supplements or enteral feeding. So oral nutritional supplements or enteral feeds can be given orally. That would be, of course, the best option, but in case of complications and in case that disease is going harder and harder, we can also use these enteral feeds, and we can use them on a short term via nasogastric tubes, or on a long term via gastrostomy or gastrointestinal tubes. So which are the indications for tube feeding? Of course, this is also the domain of the gastroenterologist, but in general, poor oral intake or dysphagia or aspiration, prolonged meal times, failure to thrive in children, and poor weight gain. These are all the indications based on which gastroenterologists may indicate the use of enteral feeding or via nasogastric or gastrostomy tubes. So tube feeding is actually quite effective, and usually it's quite easy then to increase the weight of the infant or children, and also it's quite easy to maintain optimal muscle mass. It also reduces the reflux problems and aspiration problems. On the market, we have like varieties of different oral nutritional supplements, or so-called also tube feeds. So in general, we divide them in two parts. First one, if our digestion or absorption is functional, we call them so-called standard formulas, or if it's impaired, we call them elemental formula. What is the main difference between the standard and elemental formula? You can see on those two pictures, on the left and on the right side. So on the left side, you can see intact cow's protein, and on the right side, you see the same cow's protein, but it's degraded on the basic components, which is, of course, amino acid. So amino acid, as such, they do not have any kind of they cannot cause any kind of allergic reactions, while the standard protein, cow's milk protein, let's say, may cause the the allergy reactions. So, and if you go then further on, we can divide this formula on low fiber, high fiber, lactose-free, with lactose, and then here are some other presentation, because these formulas are really for different kind of diseases. We have, a certain formula or enteral supplements to use. Nowadays, it's quite popular also blenderized tube feeding. It's growing interest, especially in US, England, New Zealand, and Australia, and also in some parts of Europe. This blenderized tube feeding is rising, and however, there is no scientific proof that blenderized tube feeding is better than, let's say, enteral feeds, which I just present you. So currently, blenderized tube feeds are not a standard of care option, and the same statement or similar statement also Evgen, so European Society for Pediatric Gastroenterology, Hepatology, and Nutrition. This was published in 2010, and it's still valid. They recommend use of pure blenderized normal foods for tube feeding is not encouraged because of the risk of nutritional inadequacy in one hand and microbial contamination in the other hand. So these are two common reasons why we are not, let's say, advising parents to use homemade blenderized tube feeds, mainly because of nutritional inadequacy and microbial contamination. So what about vitamins and minerals and specific diets used in NMDs? So there are really limited guidelines on vitamin and mineral intake. Actually, only in vitamin D there are guidelines to supplement persons with DMAD disease, and also in general in Europe, let's say 80% of people, I can say, at this moment is deficient of vitamin D. So in general, vitamin D should be supplemented to all of us, especially for those patients who are on corticosteroids. Some other use of vitamins or minerals is not scientifically proven, and of course it may be added based on the blood test. Similarly, there is no convincing evidence that some special diet, for example, lactose-free diet or gluten-free diet or vegan diet or health or ketogenic diet or any other diet should be prescribed. There is no, as I said, enough evidence to be self-confident in prescribing those diets. And in conclusion, I would like to point out 3 facts. The first one, that nutritional care is pivotal to the management of children with NMDs. The second one, standardized approaches to comprehensive nutritional assessments for all children with NMDs should be integrated into multidisciplinary care. Why is this important? Because when I go through the literature and in Europe, for example, if I focus only in Europe, there are different dietary guidelines in different countries. So dietitians are not always included in let's say in panel who discuss about the nutritional value are not included in optimizing nutrition for those patients. And they should be included because with their knowledge they can actually help patients quite a lot to optimizing their, as I said, nutritional intake, protein intake, and of course to establish the proper body mass and most importantly muscle mass. And at the end, this will facilitate consistent best patient and family-centered practice for all children with NMDs. So from my point of view, this is all, and thank you for your listening to me. And now I'm willing to answer on your questions. Thank you.
Thank you so much. So we have a couple of questions. One concerns the use of dietary supplements. What is your opinion on that?
Yeah, the dietary supplements are very popular nowadays, but we need to say that dietary supplements are not equal medicines. So these are 2 different perspectives, and also the regulation, let's say on European level, is completely different when we are talking about food supplements and when we are talking about different medicines. So here we need to be really careful, because on the internet you can buy almost everything you want, but we need to ask it ourselves, is this really good for our children or for ourselves regarding the bioavailability? That is one aspect. And the second aspect is it really, I don't know, vitamin D in this food supplement? Because it might not be there. So it should be regulated, and it should have some certificates that we can trust, some companies that we would buy those supplements from them.
Yes,
that's
exactly.
the main concern regarding this.
For instance, in Poland, it's a huge problem with dietary supplements replacing drugs in use, which is, I think, a bit dangerous. So thank you for that. And what would you say about this blenderized tube feeding as the preferred option for parents? Is it because of the financial issues or functional issues, and what's your recommendation on that?
Yes, as I mentioned, this blenderized food, actually, usually parents, they want to use it because they have better personal psychological feeling that they are doing something good for their children. They are buying extra quality, let's say, food stuff on the market, and try to, use it then for tube feeding. So of course this is one point of view, which is of course important, but when we are going, or where we are speaking regarding the price, of course it depends on the European countries. For instance, in Slovenia, the insurance company, they will cover 50% of the cost, usually 50% of the cost of these pharmaceutical produced enteral feeds. So when you start calculating the price, you will see that in Slovenia the price of home prepared blenderized food, when we are speaking of pharmaceutical prepared enteral feeds, the price is quite, I mean, it's the same. So there is no reason and no worries about price, but I know that in, for instance, I think in England, this is a little bit different. In some European countries, of course, it's different from country to country, but in Slovenia, it's arranged like that, as I said. And of course, from this perspective, it's much easier for me as a dietitian to prescribe some pharmaceutical prepared enteral food, because I know exactly what is the caloric density, how many vitamins and minerals are in there, how many proteins is in there. And then when I'm implementing this to, let's say, children, I can follow up the children and I can see, okay, the body mass is stable. Now I'm interested in muscle mass. If the muscle mass is not the good as I want, I can change the different enteral tubes with increased proteins, and then I can try to increase the muscle mass of this particular patient. Because with home blenderized food, you never know exactly how much things is in there. And although if I prepare the menu for the parents, which I usually do, if they insist to use the blenderized food, when you are cooking this food, you are losing vitamins and minerals. When you are mixing this tube, you are losing vitamins and minerals. When you are trying to blenderize it to use it, these feeding tubes, it can be very difficult sometimes. You need to dilute this food to be a proper, to dilute it properly that goes through the tubes. Otherwise, it's stuck there. You have so many problems that it's much easier than just to use this pharmaceutical prepared enteral food.
I'm looking at the chat section, and there is the question from the audience about vitamin D supplementation, the recommended dose, and whether one should get tested before going for those extra doses of vitamin D supplementation.
Yes, definitely. I mean, vitamin D is important, and I think that in all Europe or in the whole world, it's really a lot written on this topic, also in combination with COVID-19. But yes, in general, it should be tested on the blood test if you are deficient or not. But in research done in Slovenia and published also a few months ago, this year, shows that in this winter time, it was insufficient and deficient, like more than, I think, 98% of people. Only 2% of people, they have normal values of vitamin D. So, but of course, it should be before the use of some extra high dosages of vitamin D. Very clever to test it first, and then start using these supplements, and then go and testing again after 1, 2, or 3 months.
And there is last question on the chat, which concerns the difference between adults and youngsters when it comes to nutrition and NMD. Are there any studies that concern this particular difference between these two groups?
Yeah, I mean, I have noticed some studies, but I didn't go into details because for half an hour presentation, it would, that this only pediatric section where I am home there and working there, it's much easier than to make a presentation. But yeah, as I noticed, in the grown-up population, there is not so good guidelines as for children, for example. So there is much work to do also on this field, still open and it needed to be done. But let's say if you have a good practice in pediatric population, then it's a little bit easier to to go in grown-up population to use these guidelines, or of course adapt those guidelines to the needs of the grown-up people. But there I noticed a gap between the one and the other population, I noticed, but I cannot go into details about the comment because I didn't study it very well to be confident now to give any kind of comment.
Thank you. So another field of research that is open. Thank you so much. And that was our last presentation.